The pandemic changed most people's daily routines. The closer to everything have resulted in most people's life being swiftly flipped upside down. Just as stress level rose, many of us also lost access to our go-to coping skills. It's not surprising that researchers have discovered that quarantine can lead to a rise in mental illness. It is important to remember that everyone copes with stress differently and that we all react in our own way. Quarantine is an effective way to prevent the transmission of infection, but it is potentially a source of stress from fear of infection and long isolation, frustration, boredom, inadequate information and supplies, financial loss and stigma. However, researchers have shown that many of the adverse effects of quarantine can be alleviated. There is strong evidence that an inability to contact family and friends is associated with an increase in anxiety. Today, most households are hyperconnected with TV, radio, internet, mobile phones, and social media. However, there are still groups of people, particularly older ones and those with the special needs, who do not have access to these kinds of communication channels. These groups are more likely to suffer anxiety. Another potent source of anxiety centers around finance, with many fearing loss of jobs or for the self-employed a complete collapse of income. Health workers are more likely to have post-traumatic stress. Some of this may be due to the work that they are being asked to do, which is exhausting, frightening, and intense. Evidence shows that quarantining a significant fraction of population will have immediate consequences for their mental well-being, such as frustration or boredom and anxiety about becoming ill and infecting others. It's a common misconception that people are either mentally healthy or mentally ill, but in reality, mental health is a continuum, and on any given day, we may slide up the continuum towards better mental health or we may slide down the continuum towards poorer mental health. Researchers discovered that during and after quarantine, people often experienced increased sadness, numbness, fear, insomnia, low mood, depressive symptoms, anger, confusion, post-traumatic stress symptoms, stress, irritability, emotional exhaustion, and emotional disturbance. Fortunately, there are some steps you can take to build mental strength and improve your mental health during and after quarantine. Number 1. If you view yourself as being stuck, you will feel like a victim. If, however, you tell yourself that you are choosing to stay home to help everyone stay safe, this will empower you. Number 2. You may need to get a little creative if you can't rely on some of your usual coping skills. Look for ways to relax, have fun, and enjoy life, like taking a virtual yoga class or watching a funny movie. Number 3. Whether you schedule a weekly video call with loved one or you text your friends throughout the day, stay connected with other people. Number 4. Physical activity does wonders for your mood and your mental health. Find some workouts you can do from home and get some exercise. Number 5. It's important to make sure you're taking care of yourself physically, emotionally, and spiritually if you want to function at your best. So make self-care a priority. Number 6. Take breaks from watching, reading, or listening to news stories, including social media. Hearing about the pandemic repeatedly can be upsetting.